is Hot Topic. We're happy to welcome Spencer Culver, who's the advocacy specialist with Alliance for a Healthy Kansas. So as most of you probably know, the Alliance for a Healthy Kansas is a statewide coalition working to encourage people and organizations to promote policies that ensure everyone has the opportunity to attain their highest level of health. Spencer coordinates the grassroots advocates across the state, working to shape the public conversation around Medicaid expansion. Spencer, a native of Kansas City, graduated from the University of Wyoming with a communication degree and has returned to the Midwest to work in healthcare advocacy. So we are so happy to have you here today with us, Spencer. He's going to discuss Medicaid expansion 2021. What's next?
That sounds great. Thank you so much for the introduction, Denise. I think I might just jump into it and share my screen to get into the presentation that I have. Can everyone see that okay and hear me fine? Okay, sounds like it. There we go. Okay, excellent. So the title of this presentation is that Kansas needs Medicaid expansion and our movement needs you. I think that if you've been able to look outside in the past year, it's been clear that inequities in healthcare have been stark in our view, and the need for access to healthcare has never been more apparent. And that's something that we think that Medicaid expansion can be an important part of addressing in conjunction with some other opportunities. So I first want to get into just talking a little bit about what the Alliance for a Healthy Kansas is and what it is that we do. So off the top, we're a nonpartisan, nonprofit 501c3 organization like the League of Women Voters. Principally, we do policy education work. We do some legislative advocacy, and we do grassroots organizing across the state to work toward expanding eligibility for Medicaid so that more low-income people can have access to health insurance. In addition to our 5-person staff, we also have a coalition of more than 100 organizations statewide that we work together with, one of which is the League of Women Voters. And we also have a network of thousands of individual advocates who are strongly in favor of Medicaid expansion and will be active on the issue to reach out to their legislators and encourage them to pass and support Medicaid expansion. If you are not currently getting alerts from the Alliance, getting our emails or following us on social media, you can join us at expandcancare.com and find out some more information there. You can click on one of the Join Us buttons on that page, and that will sign you up for our emails. I want to go into a little bit of background about Medicaid expansion, just so people are all on the same page and understand what the opportunity is that our state has. So Medicaid expansion is a component of the Affordable Care Act, more commonly known as Obamacare. And Medicaid expansion, the design was to extend health insurance to low-income Americans so that people would have as close to universal coverage as possible. Low-income people would be covered under Medicaid, and there would be subsidies provided to people above the poverty level to purchase their own private insurance on the marketplace, which we'll kind of get into in the next slide. Unfortunately, in 2012, the provision to mandate that states expanded eligibility for their Medicaid programs was ruled unconstitutional, and that provision then became optional for states. They had to elect to expand eligibility for their Medicaid programs, which they could do in 2012, but they couldn't implement until 2014. So since 2014, we have in some ways had the good and bad luck of being one of the later states to expand Medicaid. Bad in that there are still tens of thousands of individuals in Kansas who need access to coverage that aren't currently getting it. But good in the way that we can look and see how the policy has been working in other states. Okay, sorry, I got muted for a second. I think that was Kristen. Sorry. Can people hear me okay? Okay, perfect. Let's get back to it. So like I was saying, it's good and it's bad in the sense that we haven't provided coverage to folks, but it's good in the sense that we can look at what other states are doing. And there's been a lot of research to tell us how effective it's been. So kind of going back to what I was saying earlier about this continuum of coverage, I want to look in particular to what's happening in the state of Kansas. So in Kansas, our Medicaid program requires you to be low income and meet an additional criteria. So you either have to be low income and have a disability that qualifies for federal designation through SSI or SSDI, or you have to be a parent. You have to have a family of individuals who are under the age of 18 that are living with you. And so if you're a single adult with no children under 38% of the federal poverty level, you do not qualify for Medicaid coverage in the state of Kansas, which is indicated by this gray person on the very left side of the umbrella. As you can see on the right side of the umbrella, there is also coverage for marketplace subsidies. These are individuals who get assistance from the federal government to purchase private health insurance on the federal or state exchanges, and oftentimes at very low cost, depending on the level of poverty they are. The subsidies decrease as people earn more money. The idea is to incentivize lower income people to have access to insurance and make it affordable for them to do so. But unfortunately, there's a gap of low income people between, in Kansas, 38% of the federal poverty level, which is $8,345 a year for a family of three. So if that person earns, if that single mom with two kids, say, earns $8,346 a year, she is too wealthy to qualify for Medicaid coverage and doesn't really have an option between $8,345 and $21,960. She would have to pay the full cost of health insurance and the full cost of the premiums, deductibles, and copays on the exchange if she wanted to purchase health insurance there. Medicaid expansion would make her eligible for Medicaid coverage so that she could get her health expenses taken care of, from routine cancer screenings to the management of chronic conditions, filling basic prescriptions, even to more serious health conditions, maybe related to a health emergency or a catastrophe of some kind. So if you're curious, these are the income designations. They increase based on the number of people in your household to account for how expensive it is to have children. I can send these slides afterward. I don't know that there's a lot here to say other than to kind of tell you what the differences are between incomes. So right now, the blue is what currently qualifies for Medicaid. The green is what would qualify for Medicaid expansion based on income alone. So you no longer have to be poor plus having a disability, or low income plus having a family. So that same mom with now can make between $8,345 a year and $30,305 a year, and she would qualify for Medicaid coverage. So that's just a descriptive example to tell you who it is that might gain coverage from Medicaid expansion. Like I was saying, because we're a late adopter, we can look at other states and see their successes and know that it's been an effective program. Not a single state has decided that they don't want Medicaid expansion anymore and have rolled it back. That has not happened. And as you can see, Kansas is now on an island by itself. Colorado, Nebraska, and recently Missouri and Oklahoma have all expanded eligibility for their Medicaid programs, which means that they can draw down more federal money and providers can afford to pay their doctors or nurses or other health professionals higher salaries and potentially create a competitive disadvantage for providers in the state of Kansas. So not only is this important for the health of our population, but also the health of our providers and their continued financial viability. Like I said, there's been a lot of research on this issue. It's been studied to death. The Kaiser Family Foundation, one of the most reputable health foundations and health research organizations in the country, has done a review of over 400 research studies on the topic of Medicaid expansion, which is a lot of studies. They've covered a number of different issues, and they found, by and large, this has been an overwhelmingly successful policy. It has first made more people have access to health insurance, which as a result means that they can afford medical care much easier. They can get in to see a doctor more regularly and more accessibly. And as a result, they're getting care more. They're getting checkups, they're getting cancer screenings, they're filling prescriptions and better managing their health. That's valuable because an individual can take care of things early and engage in preventive care to better manage their health conditions rather than waiting until something becomes very severe, going to the emergency room where the emergency room has to provide treatment for them, often at a very high cost that gets passed on to that consumer. Medicaid expansion has been found to reduce medical debt because preventive care is much cheaper. Getting care at the emergency room is often very expensive. And if you can't afford your own medical insurance, it's very unlikely that you're going to be able to afford the high bill that the emergency room sends you after getting a pretty extensive treatment done there. So Medicaid expansion is able to reduce medical debt, which in the United States, as well as in Kansas, is the leading cause of bankruptcy for consumers. So it's a really important family financial consideration too, that we extend coverage to low-income people to better manage family finances and provide them a little bit more disposable income to pay their bills, pay their rent, pay for clothes and school supplies for the kids, that kind of thing. The other thing that this research has found is that it decreases uncompensated care costs for hospitals. So go back to the medical debt example. A consumer gets a bill for $10,000 for an emergency appendectomy, say. The hospital might have to write off that $10,000 because this individual just can't pay it. Over time, those expenses add up and it becomes a pretty significant financial loss for hospitals to continue doing that. Medicaid expansion, by providing coverage, provides payment for those hospitals so they can more readily manage their uncompensated care for care that they dole out in the emergency room or other services, so they can be in a better financial position. And that's been backed up by research, particularly in rural hospitals in other states. And we expect that to be the same here in Kansas. Getting into some of the particulars about health, I think is pretty relevant. There have been two really salient topics around health in the United States this year. One is mental health, and the other is racial disparities and access to care and health outcomes. So I want to talk about both of those things. So right now in Kansas, there's a pretty significant unmet need for healthcare. About 1/3 of Kansans who would gain coverage through Medicaid expansion had some sort of issue with mental illness or substance use disorder in the past year. When talking to those individuals, they reported that cost is the most significant barrier to care. It's just too expensive to get mental health care when you don't have insurance. And as a result, of that 1/3 of Kansans who would be eligible for expansion, less than 14% of those people actually receive treatments. There's a big need in our state for better access to mental health care and better utilization of mental health care services, but it's just too expensive for people to do that. What Medicaid expansion does is it meets that need. People who are enrolled in Medicaid expansion in other states were found to be 30% more likely to receive treatment. And also it increases preventive care, which, like I was saying earlier, drives down the cost of care overall and better manages people's health conditions. So it's better to provide coverage to folks. They can get care early and get their health taken care of so they can contribute more fully to society, whether it's taking on more hours of their job, feeling like they're healthy enough to go back to work, or just being a more healthy member of society generally. The next thing I want to talk about is racial disparities in health and what Medicaid expansion can do. So a study in Kansas found that 67% of uninsured low-income Black Kansans reported not being able to see a doctor because of cost. Similar to mental health, it's just too expensive to seek medical care without insurance. In other states that have expanded their Medicaid programs, we've seen the disparity in coverage between Black and white adults shrink by over 50%. So say in a state that hasn't expanded Medicaid, white adults are uninsured at a rate of 10%, and Black adults are uninsured at a rate of 20%. Just round numbers, for example, what Medicaid expansion would do is it would shrink that gap down to only a 5% difference rather than a 10% difference, which in raw terms, in statistical terms, is a very significant reduction in terms of the disparity in coverage. So Medicaid expansion can address that gap, but more importantly, it can also make a pretty significant difference in terms of health outcomes. In Medicaid expansion states, Black cancer patients were reported to receive treatment more quickly for their cancer, and it also was found to reduce the disparity in colorectal cancer mortality between Black and white patients completely, which is huge. So these opportunities are really significant, and at a time where we're as a nation reckoning with racial disparities and systemic racism, this is a pretty significant policy tool that we can use to level the playing field in terms of racial disparities and access to care. The next thing I want to talk about, which is a common discussion in Topeka in the State House, is what are the financial implications of this policy and how does it affect the state budget and our state economy? As you know, that's often one of the most significant things when deciding any piece of legislation. The first thing I want to say is this is a tremendous deal for states. The federal government has agreed to pay for 90% of the cost of Medicaid expansion. So we put in $1, the federal government puts in 9, which is much higher than the traditional Medicaid program and much higher than many other programs that the federal government co-funds with state governments. So this is a really significant opportunity for the state to put down a little bit of money and get a lot of money back, which we can help recoup through tax revenue. Actually, a study done by an economist at Kansas State found that Kansas is projected to bring in somewhere between $31 and $39 million per year in new tax revenues if Medicaid is expanded, which will cover or potentially even exceed the cost of Medicaid expansion, the 10% share. That money that we could have been getting back, that 90% that could have been coming into the state of Kansas, has added up since we've had this option in 2014. And to date, our state has forfeited $4.5 billion that could have come into Kansas by not expanding eligibility for CanCare. So that's not only $4.5 billion we could have been creating jobs and healthcare, providing coverage to people who need it, updating medical equipment so that we can provide better care to people. But we're also missing out on opportunities for tax revenue that our state could have picked up by not expanding eligibility for Medicaid. So this is a pretty significant financial opportunity for states as well, in particular Kansas. In addition to the sort of tax and financial impacts, we've seen a pretty significant impact on economic growth. And particularly, we think that this policy can bolster the economic recovery here in the state of Kansas. So I already told you it's going to inject hundreds of millions of dollars into the Kansas economy. We also anticipate that it will create more than 13,000 jobs in the first full year, which is a very significant number, particularly given that we've seen higher levels of unemployment in the past year as a result of the COVID-19 pandemic and resulting economic consequences from that. And like I was kind of teasing in the earlier aspect of my presentation, with Missouri and Oklahoma now expanding their Medicaid programs, they can draw down more federal funds and pay their healthcare workers more money, which can be a more attractive option. It's certainly not out of the question for someone to commute from Lawrence to somewhere just over the Missouri border to go work a nursing job instead of working at Lawrence Memorial Hospital. It's even more likely in Kansas City, when the commute might change by only 10 or 15 minutes. So these are really important considerations that we think state leaders and advocates need to take into account. I've included a couple of graphics here about how this has affected other states. In Michigan, they found that 30,000 new jobs were created. They also found a $2 billion annual increase in personal income as a result of this. In Louisiana, they found that $1.85 billion were injected into their economy, and tax revenues at the state level went up about 100 million, excuse me, with an M, not a B, and then 75 million in local tax revenue. So the economic opportunities are pretty significant with these policies. We've seen that borne out in other states. The next thing I want to talk about is strengthening hospitals and rural communities in particular. So the most recent data that I've seen on this question says that 76% of Kansas rural hospitals are at immediate or high risk of closure due to financial instability. This past year has been much harder for rural hospitals. I think people have been declining to take elective surgeries because of concerns about the COVID-19 pandemic and potentially getting sick. A lot of the rural population is older than urban or suburban population. So there's an increased risk factor that some people may perceive in getting access to elective surgeries. What we've seen from other states is that expanding Medicaid can help rural hospitals be more successful. They can reduce their uncompensated care and better manage the financial picture so that hospitals can keep their doors open. I've included a picture here of Sumner Community Hospital in Wellington. Just about a year ago, they closed their doors because they didn't have the money to stay open. Medicaid expansion could have helped reduce their uncompensated care and brought a little bit more money into that hospital, which could have made an impact on their overall financial picture. The next thing I want to discuss is how this helps Douglas County, how this helps our county. We have county fact sheets on our website for every county in Kansas. So if you have a friend who lives in Kingman County, for example, you can go and look that up on our website and find out how many people would gain coverage that don't have it right now because of expansion, how much money would come into that county as a result of new annual healthcare spending, how many jobs would be created. About 3,800 people in Douglas County who didn't have coverage before would gain it if we expanded Medicaid. We can expect about $25.5 million in new healthcare spending if Kansas expands Medicaid. And we can expect over 650 jobs to be created if we expand access to Medicaid in Douglas County. So this makes a really significant difference for our local communities and our healthcare providers, and in particular, citizens who need access to care. So this concludes the sort of what does the policy do, that sort of thing component to the presentation. I want to transition now to talking about the political and policy and legislative dynamics so that we can kind of talk a little bit more about advocacy. So just some background on Medicaid expansion if you haven't been paying close attention to this issue for the past 5 years or so. In 2017, the Kansas House and the Kansas Senate actually passed a Medicaid expansion bill. It was vetoed by then Governor Brownback, unfortunately, and Kansas was only 2 votes shy of overriding that veto. So unfortunately, we did not expand eligibility for Medicaid. The next year in 2018, there were some hearings on Medicaid expansion and the bill passed out of committee, but leadership in the Senate blocked it from further consideration on the floor, which you may sense in the next slide is becoming a theme. Leadership in the House and the Senate have continuously blocked debates on Medicaid expansion. So in 2019, there was a pretty significant victory for the policy, though, and that Governor Kelly was elected. And she is a strong supporter of Medicaid expansion, which means that should a bill pass through the legislature, it is very likely that she would sign it. In 2019, the other things that are worth noting is that there was, again, leadership opposition. The House passed a Medicaid expansion bill, but it wasn't taken up in the Senate. In 2020, there was an opportunity to act on that same bill, and there was even a bipartisan agreement between Governor Kelly and Senate Majority Leader at the time, Jim Denning, to expand eligibility for Medicaid. There were even 22 co-sponsors on the Senate legislation, which is a majority of senators. Unfortunately, that was met with opposition from anti-abortion advocates and conservative leadership. And then the pandemic threw a wrench into the whole legislative session and ended things abruptly. So there wasn't an opportunity to expand eligibility for Medicaid. Fast forward to this year, we have a whole new legislature, which means that in order for Medicaid expansion to pass, we have to have new legislation. We have to pass it in both houses. Leaders in the House and Senate still oppose Medicaid expansion. And for the first time in several years, we are short of a majority in the Kansas House and Senate, which means that we have to do more persuading of our colleagues in the Senate and the House to support Medicaid expansion in the first place. So I think that that's something that's worth considering too, that our advocacy work is cut out for us, and we'll have to engage in a number of different tactics to convince people to support Medicaid expansion. Fortunately, there was an incentive passed last week from the federal government that should make this much easier. So as you may know, President Biden and Vice President Harris passed the American Rescue Plan to the House and Senate, provided for a number of things that we don't need to get into. One of the minute ticky-tacky details in there was an incentive for states that have not expanded Medicaid to expand eligibility for those programs. If they did so, for the first 2 years, 8 quarters, states would receive a 5% bump in the match rate for their traditional Medicaid program. So that's low-income people with disabilities, low-income parents, a 5% bump for that group, which national think tanks have kind of worked out for each state. And our estimate is that that would be somewhere between $330 million and $450 million over the span of 2 years. So these are additional funds that can be unlocked for COVID relief. And better managing our state budget and being able to fund essential priorities for our state across a number of different issues could be unlocked to us should the state legislature decide to act and expand eligibility for their Medicaid programs. The other thing that's relevant to consider with the federal landscape is that the Biden administration is less likely to approve some detrimental provisions to Medicaid programs that have been floated in the past. So just recently, the Biden administration said that they're unlikely to support work requirements, work reporting requirements. So what those are that, if you live in Arkansas, for example, they have implemented a work requirement system, or they did until it was held up in court, but we don't need to get into that. What they would say is you have to go online and report with proof that you were working a certain number of hours a week, or you were volunteering 20 hours a week. And it's posed a pretty significant problem for folks who didn't have access to internet, or the website was only open during weird hours, or it would crash because there were too many people on it. Ended up with 18,000 people losing access to their health coverage. Not because they weren't working. We don't know if they were working or not. They just didn't meet the reporting requirements. So because of bureaucracy, people lost access to coverage. The Biden administration is unlikely to approve detrimental provisions like that, which is, I think, a strong thing for advocates like us to hear. The next thing I want to do is talk about the governor's bill in 2021. So she proposed to expand Medicaid with pretty much the same provisions as the 2020 compromise bill. Beneficiaries would pay for a small premium. If they weren't currently employed, they would be referred to a program in the Department of Commerce to help them find work. And the payment method would be a little bit different. Instead of putting a surcharge on hospitals, the governor proposed to legalize medical cannabis, and the proceeds from that system would pay for the state portion of Medicaid expansion. The other thing in this bill is that it would specifically not allow smoking or vaping of medical cannabis. So this has been sort of controversial for some advocates in our coalition. So we've elected not to take a stance on the medical cannabis component of this legislation, but we do support Medicaid expansion fully and access to care through that provision. So that's sort of an update on what the governor's proposal is. That's Senate Bill 287, I believe. I can double check that in the comments or the chat in a second, but you can check that out on the Kansas Legislature website if you are interested. The next thing I want to do is talk about how you can get involved. Like I said at the beginning of our presentation, if you're not currently getting updates from the Alliance for Healthy Kansas on the latest research, what's happening in the legislature, how you can become involved on this issue, you should go to expandcancare.com and sign up for our email alerts. You can stay informed on the topic and engage your legislators and engage your personal network on the issue. You can also follow us on Twitter or Facebook. Our handle at both is expandcancare. And the easiest way, I think, for you to email or call your legislators is by signing up for our text service program by texting CANCARE, KANCARE, to 52886. It's 52886. And what that will do is whenever there's an important action alert, if there's a vote in the House, say sometime in May, we'll shoot you a text and say, hey, it's really important. Will you send an email to your legislator and say, we want you to support Medicaid expansion and vote yes on this. And then you can just click a link. There's a pre-written thing, you can edit it, and then it sends it right off from your email address. So it's a really quick and easy way for you to get in touch with your legislator on this issue. And you don't have to be by your email all the time waiting for action alerts from us, or heaven forbid you forget to check your email and you miss the window. The text just makes that all the easier. The other way that you can get involved is you can make introductions to local groups or community leaders, whether that's the pastor at your church or an organization providing services to people living in poverty, or assisting individuals who don't have access to coverage right now. We're always looking to work with new organizations to involve them in our advocacy work. You can write a letter to the editor or an op-ed for your local paper. I can link you up with our communications director, fellow Laurentian, Lauren Beatty, and she'd be happy to help you put that together and do some writing. The other thing I think you can do is engage in relational organizing. You can get friends to work toward Medicaid expansion. It's no secret that in Douglas County, they have a more progressive delegation that's sent to Topeka. So oftentimes we hear this from folks, in Douglas County or Wyandotte County, where there's really significant support for Medicaid expansion already. And people want to know, what is it that I can do to support Medicaid expansion? Think about your personal network. Who do you know? Who do you interact with that may live in an area where their legislator does not support expansion, or might need to hear from their constituents this is an important issue? So think about that and maybe give them a call or shoot them a text and say, hey, I think that you'd really be interested in learning more about this issue and talking to your legislator about it. The other thing you can do is you can reach out to your legislators and thank them for their support of Medicaid expansion in the past and encourage them to continue to do that in the future. Most of the Lawrence delegation has already had to take a vote on this issue or has taken one in the past. I think there might be one member who hasn't done that yet. But anyway, all of this is saying, you can reach out to them and provide thanks for them supporting Medicaid expansion, because without our strong legislative champions, this wouldn't be possible. And if you are having a conversation with your legislator who, you want to really sell the issue, think about your story. Why are you involved? Do you have a family member who doesn't have coverage right now who could gain it if we expanded eligibility for Medicaid? Share that story with your legislator. That can be a really important piece of an impassioned speech that they give on the floor of the Senate or House to support Medicaid expansion and say, this is why we need to do this. This is important for my constituents. I heard this story. We need to address this now. So I would urge you to think about why you're connected to this issue. The more personal you can make it to yourself, I think the more persuasively you can speak on it, and the more mileage you'll get out of your advocacy pitch. So that concludes the presentation aspect of it. I'm going to stop sharing my screen for now so that we can chit chat a little bit more. I'm happy to take questions or talk more generally about Medicaid expansion. If you have some follow-ups, I can pull up the slides too if you have questions about one of the maps that I have or the income tables or whatever. So I'm happy to do that.
Thank you, Spencer.
Thanks, Kristen.
So everybody is on mute right now. If you have a question for Spencer, go ahead and unmute yourself. I think that we have a small enough group here that we can just ask questions and make comments. But just know that you have to unmute yourself as you do.
Spencer, I was curious as to how the legislators who are opposed to Medicaid expansion, how do they square that view with the dire situation of rural hospitals, and how that just makes it's like, how are they putting that together? Have you heard any kind of statement from them that why they're acting that way or what their position is?
Yeah, I can try and fill in some gaps. I think that I haven't necessarily heard a full depiction of what their views on the issue are, but I can start to get at it. So I think people who oppose Medicaid expansion and think it won't help rural hospitals think that Medicaid expansion won't make a significant difference or save rural hospitals, which I don't think that anyone at the Alliance has ever gone as far as to say Medicaid expansion would mean that no rural hospital would close ever again. Obviously, running a hospital is complicated business. There are a lot of things to consider when doing that. What we do know is that rural hospitals face high levels of uncompensated care, and Medicaid expansion can reduce that uncompensated care by providing coverage to people. In other states, we've seen rural hospitals close at a lower frequency in expansion states than non-expansion states. So I think that that's their main provision. And in Southeast Kansas, they've seen a lot of rural hospitals close, and people have, to various degrees filled in. So in Fort Scott, there's a standalone emergency room now that Mercy is running, and the Community Health Center of Southeast Kansas is doing some primary care work, but not all services are provided there. So people have to drive a little bit farther. In Wellington, where Sumner Community Hospital closed, I talked to a couple of people who live there who have to drive out of city. They have to drive to Ark City or Wellington, or not Wellington, or Winfield, or they all drive all the way up to Wichita just to get basic imaging done. So I talked to a woman who works full time, has a couple of kids, and doesn't have a whole lot of free time. And she was like, it was really hard for me. I needed to go get a mammogram to get just a routine cancer screening done, but I didn't, it was really difficult for me to find the time to do it. I had to ask for a ride because my car broke down. It just creates added layers of complication when rural hospitals close, not only to people who don't have insurance, but also to those who have insurance. If, heaven forbid, you have a really serious health crisis, you have a heart attack, or you have a stroke, you want to get to the hospital as close as possible so they can try and stabilize you and provide care. So whatever tools we have in our toolbox, arrows in our quiver to help rural hospitals, I think it's important that we take them.
Do you see any path forward for this year? Or how do you see a path forward for this year?
Yeah, I think that the path forward for this year is going to be not atypical from the previous years. So in the past, leadership has opposed running things through the committee process and allowing an open debate on the floor of the Senate. There have had to be various amendment strategies to try and pass Medicaid expansion. So if I had to guess, that's the scenario for it to happen. But before any of that takes place, we need to, do some work on the ground to get a majority of support for Medicaid expansion. So that's what we're focusing on right now, doing intensive community organizing in key Senate and House districts to encourage legislators to support Medicaid expansion. And if there is an opportunity to do that, certainly we'll take that up when available. But it just kind of will depend on what gets taken up by the legislature.
Do you think that the governor's plan has any whisper of a chance?
Well, that's a good question. I don't want to speculate too much. I know it was just referred to the Public Health Committee. The chair of that and the vice chair of that committee are opposed to Medicaid expansion. So we'll see what happens there with that bill. In years past, it's been difficult to get hearings, particularly in the charged political environment we're in right now. So we'll see how that goes. There's a separate medical marijuana bill being run in the House and the Senate. So I think that adds another layer of complication. But I don't have as many conversations with legislators as other people on my team. So I'm not in a good position to look into my crystal ball and do some forecasting for you today, unfortunately.
And the sweetening of the deal with the potential COVID relief that would come with it, with the Medicaid expansion, do you think that could possibly sway any of these legislators?
Yeah, I really do. In a time where dollars are more scarce and we're worried about the unemployment trust fund and funding public schools and providing more money to mental health care providers, I think our legislators are realizing that we'll have to, work through appropriations and try and make the dollars and cents work. So this is a very real opportunity for Kansas to draw down some federal funds and make balancing the budget a little bit easier. And I think that this is an opportunity to get some people on board with it that we may not have previously had otherwise. But again, it's going to take some work. We're going to have to talk to these folks. This legislation was only passed recently, so we still have some legislator and public education to do on the issue to let them know that this is an opportunity that we can draw on. But I'm hopeful that it can change some minds.
I get so frustrated because it makes perfect sense in so many ways, and yet it's just stonewalled completely in our legislature. I'm glad that you feel hopeful that would make a difference, because it makes a whole lot of sense that it would make a difference.
Yeah, that's a lot of money, hundreds of millions of dollars. $330 to $450 million is a big chunk of change for 2 years, particularly, if there are concerns about what our income tax receipts are going to look like. So I hope that legislators take a second hard look at it and say, hey, I think the time is finally right for us to extend health coverage to people. We're going to get paid to do it. So let's do it.
Yeah. And then if you look back at $4.5 billion that we've essentially lost already,
yeah,
it's ridiculous that we wouldn't expand it. But
it is.
Yeah, but that's still where we are. It seems like we've gone backwards from 2017, really, as far as support.
Yeah, in some ways, yes. In other ways, no. We have a little bit less support in the legislature. We do have a supportive governor. So, it's a balancing act. It seems like,
combine the two.
Yeah. Wouldn't that be nice? So, and we're really working hard to get there, to get a majority in the legislature to make those stars align. But it's tough work. The political environment that we live in has gotten more extreme and partisan and divisive, and finding common ground has become more difficult. I think that in conversations that I have with people across the state, this seems to be a common sense issue that people can all come together and agree on. But once you get under the dome in Topeka, there are all these political dynamics that get mixed in, and it becomes more difficult for us to see a path forward. So that speaks to the importance of constituents raising up their voices and saying, this is essential to me and my community. We can't afford to lose out on the federal money that we could get to better fund state services, or the money we would get in healthcare spending to provide care to people and help more people get basic healthcare. In Douglas County, there's a lot of money on the table and a lot of people that this could help.
Mm-hmm. So in your travels across the state, are you met with really any opposition from the average citizen?
I would say no, not really. Questions are more common. I mean, to some extent, we're there to talk about Medicaid expansion. So I think our audience can sometimes be self-selecting. If you oppose Medicaid expansion, you may not come to an event to hear about why Medicaid expansion is good. It's a sort of echo chamber problem that we're experiencing as a country. But just hearing folks who maybe, get dragged along, or we're at a public library and they swing by and listen to us, they have questions. They think, what about this? Is this going to affect people's interest in working a job? Can they just stay home and collect money from Medicaid? Which, no, they can't. So people are sometimes fuzzy on the details, but once we explain it, they typically realize it's a pretty good deal for our state. So more often we're just met with questions and people trying to get more info, and maybe being skeptical at first, but once we talk it out, it makes sense to them. There have been a couple people who are opposed to it, and that's going to be the nature of things. But by and large, we have a pretty positive and welcoming crowd.
Well, it just makes a whole lot of sense. Judy raised her hand over there. Judy, did you have a question?
Yeah, I was wondering, how much does pro-life have to do with torpedoing CanCare? Because it seems like that's what comes up a lot in the state legislature as objections. They continue to put abortion on everything. Well, I'm exaggerating, but they seem to be putting abortion on things that they don't like. So I might have missed out on your talking about that, but that's my question. And it seems like such a bulletproof argument that they can just stop anything with that argument. If there's a way to work around that, how do we deal with that? Okay,
Yeah.
Thank you.
No, that's a great question. I briefly touched on it, but I didn't really get into the nitty-gritty of it. You're right that the abortion issue and pro-life politics can be a lightning rod in Kansas. I pulled up my screen again because I wanted to show you this table of what the Medicaid and Affordable Care Act guidelines look like. So in pink here is 171% of the federal poverty level. These are people who are currently eligible for CanCare as a pregnant woman. We extend traditional Medicaid services to pregnant women up to 171% of the poverty level. You will notice the upper limit to Medicaid expansion is 138% of the federal poverty level. So Medicaid expansion doesn't make any pregnant women eligible for Medicaid that wouldn't already be eligible for it. So I find it unlikely that Medicaid expansion is going to increase access to abortions. And when you add that to federal and state prohibitions on using public money to fund abortions, it makes the argument much less compelling. So I just wanted to share that information so that we're kind of on the same page about the income guidelines and what the probability of the pro-life argument as it relates to Medicaid expansion is. I think it's unlikely to have an effect on it at all, but that doesn't stop people from talking about it. So that's what I would say to respond to it. Yeah.
It was just that the legislature was determined to pass a constitutional amendment to ban abortion before they'd talk about anything else.
And
basically.
now, yeah, and they've said once that happens, we'll talk about Medicaid expansion, and they passed the amendment, and so we're still waiting. So, Lynn, I think you've been patiently waiting for a while to ask a question.
Yeah, as a Douglas County person whose representatives and senators are already on board,
Mhm.
is there anything that an individual person can do?
Yeah, great question. I'm in the same boat. Marcy's my senator and Boog is my House rep, so
Yeah.
they're there for it. What I want to think about and what I try and do is who's in my network that lives in a district where someone does not support Medicaid expansion? Who can I get on the phone? Who can I send an email to? Who can I text? And say, hey, this is a really important issue to me. I want to spend 5 minutes talking to you about it. And after the presentation, if you've learned a little bit about it, you can take that information, go onto our website and look at our fact sheets to get a little bit more info and talk to people who are in those areas. So if you have thoughts about people who might live in areas where Medicaid expansion is not supported by their delegation, I'm happy to talk with you a little bit more about that offline and just chit chat a little bit more about some opportunities there. I'll put my email in the chat so that everyone can get in touch with me about this. Should they be interested in talking Medicaid expansion generally, or how to engage people in their personal networks? Because I'm with you, Lynn. It can be a little frustrating to feel like my legislators are doing the right thing all the time, and how do we make a change? And that's what I see.
I don't know anybody outside of this area. I have one person in Western Kansas that I correspond.
Well, that's something. We're working right now to explore opportunities for people who live in areas like Douglas County or Wyandotte County, where their delegations support Medicaid expansion, to talk to advocates in other parts of the state where they don't support Medicaid expansion, whether that's phone banking or text banking, maybe writing postcards. So that's something that we have in the works right now. That seems like something that League of Women Voters might be interested in working with us on, but I don't want to put the cart before the horse on those sorts of things. So we'll keep you in the loop. But does that sound like something that would, satisfy you? We provide some names, you give them a call and say, hey, this is really important. Could you reach out to your legislator? That kind of thing?
Yes.
Okay. Good to hear that. Dorothy agrees. Thank you, Dorothy.
Yeah, I would agree. I think that we have a lot of members that would be happy to participate in something like that.
Yeah. And that's something I saw this year, just in the US Senate election. I got postcards from all over the place that were stamped from Oregon and Colorado and, various places. So the world is smaller now, and I guess postcards have been around forever. I don't know what I'm talking about, but there are opportunities for us to engage people outside of our backyard.
Well, and didn't you get about 1 billion text messages?
I did, yeah. You give money one time and then you get 1 million emails.
Yeah. Yeah.
Anyhow, so are there other questions, other thoughts? We've got a little bit more time, but I don't want to keep anyone on for longer than we need to.
Well, this is such good information. It really is. And it gives you a broader understanding. I think most of us understand why it's important, but you went a little deeper dive into it. So I appreciate that a lot. And you're certainly talking to us, a friendly crowd right here, because we all definitely, there's just so many reasons that it needs to happen. Yeah.
Well, I can follow up and send Denise my slides if anyone wants to have those on hand. And if you're going to do some phone banking for us or want to talk to people in your network about Medicaid expansion, you can also go to our website. We have a fact sheet on pretty much anything you could think of in relation to Medicaid expansion. That's all we do. So check that out.
That would be great. Thank you. Yeah. Does anybody have any questions or comments or anything for Spencer before we go? All right. Well, thank you so much for joining us. Denise, you're muted.
Hi, there I am. Well, if there aren't any other questions, I'd just like to say thank you so much for your time today, Spencer. Really appreciate it. Really great info. We will have this recording posted various places, hopefully on our website, hopefully on our YouTube channel. And so, yeah, thanks again.
Of course, I was happy to do it. Always good to give back and talk to the hometown team in Lawrence and Douglas County. So hopefully we can find some ways to get places like Douglas County involved in getting people to support Medicaid expansion. Because I understand how frustrating it can be to, have legislators that just agree with you on everything.
Yeah.
It's good, but sometimes you gotta have that advocate energy channeled somewhere.
Yes. Yeah. Keep us in the loop on what you might need assistance with.
Totally, I will.
We would definitely be happy to help.
Great.
All right. Thank you, everybody. Thanks for being here. Thank you, Spencer.
Okay, that sounds
Okay.
good.
You all have a good afternoon. Okay. Bye.